What happens when an elderly woman confronts President Trump in a packed hospital ward, demanding answers about a sudden healthcare funding cut that's left her family desperate? Will he walk away or step up? The tension builds as Trump, on a surprise visit to assess hospital conditions across the nation, pauses mid-tour, his security detail close behind. The ward buzzes with patients and staff, all eyes turning as Letitia Harwood, an elderly woman with a trembling voice, rises from her bed, tears streaming down her face. She clutches a crumpled letter, her grandson's denied treatment notice, and steps forward, stopping Trump in his tracks. Trump turns, his expression firm, flanked by aides and medical staff. "What's this about?" he asks, his voice carrying that familiar, commanding tone. Letitia, her hands shaking, holds up the letter. "Mr. President, my grandson needs surgery, but they say the funds are cut. We can't pay. What are you doing about this?" The room falls quiet, staff exchanging glances, some nodding in support, others waiting to see how Trump responds. Trump steps closer, adjusting his stance. "Letitia, I hear you, okay? We're working on the best healthcare system, tremendous system, nobody does it better. These cuts, they're about efficiency, making sure the money goes where it's needed most." Letitia shakes her head, her voice rising. "Efficiency? My grandson's life isn't efficient to lose. They told us the new policy stopped his coverage. How's that fair?" A nurse nearby, Dr. Selma Rourke, steps in. "Sir, we've seen a 20% drop in funded cases since the policy shift. Patients like Letitia's grandson are suffering." Trump raises a hand, undeterred. Hold on. I get it, but let me tell you, we inherited a mess. A total disaster. The old system was wasting billions on bureaucracy. We're streamlining, getting it right. Your hospital, it's part of that fix." Letitia wipes her eyes, her tone sharp. "Streamlining? My boy's in pain, and your fix left him out. I worked my whole life, paid taxes, and now this? Explain that." The staff murmur, a few patients leaning forward, drawn into the exchange. Trump points at the letter. "Show me that. Let's see it." "I'm not here to ignore people. I'm here to make America great again, healthcare included." Letitia hands it over, and Trump scans it quickly, his brow furrowing. "This says denied due to new allocation rules. Okay, but who decided this?" "Hospital management, tell me." Dr. Rourke speaks up. "The administration here adjusted based on your policy guidelines, prioritizing emergency cases only. Elective surgeries like Letitia's grandson's got deferred." Trump turns to her. "Deferred? That's not what I meant. I said prioritize smart, not cut people out. Who's running this place?" A hospital administrator, Mr. Thane Cliver, steps forward, nervous. "Mr. President, we followed the federal directive. The budget was reduced, so we had to reallocate." Trump cuts in, his voice rising. "Reallocate? That's a fancy word for dumping on folks like Letitia. I didn't sign up for that. My administration's about helping, not hurting. Show me the numbers, the real numbers." Thane hesitates, then pulls out a tablet, projecting a chart. "Here, sir. Funding dropped 15% this quarter, forcing us to cut non-urgent cases." Trump studies it, then points. 15%? That's a lot, sure. But look at this. Administrative costs are still 30% of your budget. Why? That's where the waste is. We're cutting fat, not patients. Letitia interrupts. "Fat or not? My grandson's not a number. He's a child who needs help now. Can you fix this, or are you just here for photos?" The room tenses. Staff nodding, some whispering agreement. Trump leans in. "Letitia, I'm not here for photos, believe me. I'm here to fix things. But this hospital, it's gotta do better." "Thane, why's your staff stretched thin? More admins than doctors?" Thane stammers. "We've had to hire more to handle the new reporting requirements from your policy." Trump shakes his head. "Reporting? That's backwards. I want doctors, not paper pushers." Letitia's right. This isn't working. "Dr. Rourke, you agree?" Dr. Rourke nods. "Yes, sir. We need more hands-on care, not more forms. The cuts hit us hard, and patients feel it." Trump paces slightly. Okay. So the policy's good, but the execution's a disaster. "Letitia, your grandson's case, why is it elective? Explain." Letitia steadies herself. It's a heart procedure, not an emergency yet, they say. But if we wait, it could be. The doctor said it's urgent soon. Trump looks at Dr. Rourke. True? She nods. Yes, Mr. President, it's borderline. Without funding, we risk complications. Trump turns to Thane. Borderline? That's not acceptable. Why wasn't this flagged? Thane shifts. The system prioritizes based on immediate risk. We're understaffed to review every case. Trump frowns. Understaffed because of admin bloat. I see it now. Letitia, this isn't your fault. It's theirs. Letitia presses. So what now? My family's out of options. Trump pauses, then pulls out his phone, dialing an aide. Get me the health secretary now. We've got a problem here. He waits, then speaks. Yeah, it's me. Hospital's a mess. Cuts are hitting patients, not waste. Fix it. Start with Letitia Harwood's grandson, full coverage, today. And audit this place. Cut the admin fat. He hangs up, turning to Letitia. Done. Your grandson's covered, all expenses. We're sorting the rest. Letitia's eyes widen, tears falling. Thank you, Mr. President. Thank you so much. The staff claps softly, Thane looking stunned. Trump nods, adjusting his coat. That's what I do, help people. This hospital's got work to do, but we'll get it right. Take care, Letitia. He turns, exiting the ward with his team, leaving Letitia smiling through tears as the room settles. If this moment touched you, take a moment to reflect and share it with someone who might need it today. Don't forget to subscribe and drop your thoughts in the comments below.